All right, let's now go to one of the top stories around the world, with Israel and a number of other countries closing off entry to foreigners as fears mount over the new omicron variant of COVID, as scientists scramble to try and work out how it'll react with the current vaccines on the market and just how fast it spreads. Now, for more on this, I'm joined by Dr. Angelique Coetzee, the chairperson of the South African Medical Association and an advisor to the South African Health Ministry. Doctor, thank you so very much for joining us this evening. Firstly, how did you discover this virus?
So, good evening. I didn't discover the virus. I was just the one that brought the clinical picture, that saw the clinical picture didn't fit in with the normal Delta variant that we normally see, and that was on the 18th of November. And that patient was a man who came to the surgery with complaints of tiredness, headaches, didn't feel well, and he presumed that it was because he was working the previous 2 days in the sun, and thought that was linked to that. Didn't make sense to me, and I subsequently tested him. Found out that he's COVID-19 positive. And that day I saw 7 people, all of them positive. Symptoms, again, not the same than what we normally will see with the Delta. What I didn't know was that in the background, the Lancet lab in South Africa and Pretoria also picked up an abnormal PCR test and also alerted NICD on that. So I alerted my advisory committee on vaccines, and so at that stage we were not aware of any variant. So for me, clinically, the symptoms was much more closer to the beta variant, and only last week that our scientists then announced that indeed there is a new variant, and that's how it come to the story.
So, Dr. Coetzee, tell me, what exactly are these symptoms and how do they differ from the Delta variant?
Okay, so it's very mild symptoms. It is the term that we use is malaise. It means I've got a bit of a fatigue, I've got a bit of a body aches and pains, I've got a slight headache, I'm tired, and they can have a scratchy throat. That's what they call it. The patient says it's a bit of a scratch in the throat. Some will say they think they had a fever, but very seldom did I encounter any fevers. It's only one child that was extremely sick that had a fever. But that's it. And so what is the Delta variant? The Delta variant will give you what we will call a blocked nose. You know, it's something, my nose is not okay. You know, that type of nose, loss of taste, loss of smell. They would also have what we have seen. They tend more to have a very high pulse rate, oxygen levels normally, but lower with the Delta variant. So especially from day 5 onwards, we had seen with the Delta variant that patients would then turn, especially your patients above the age of 50 with comorbidities. So far, we haven't seen that type of clinical picture at family healthcare practitioners. I'm not talking about hospitalization. So our cases are very slightly rising in the hospitals, 1 or 2 per day in the hospital. Not sure whether it's Omicron or Delta. Unfortunately, we don't have that information. But for now, the majority of patients that are seen at the normal practices, the family practitioners' practices, are mild symptoms. Yes, there are people who have been vaccinated, but they're also mild.
So, Doctor, given that, in your opinion, just how much more dangerous is Omicron than the Delta variant?
At this stage, it's still too early to say whether it's going to be more dangerous. It is just as fast spreading, maybe faster. I don't know. The time will tell us on that one. So it's the symptoms. And look, it's still early. It's it's barely 2 weeks. Tomorrow it will be 2 weeks. But again, for now, what we see is mostly mild cases. Not saying it's going to stay like that, We hope it is going to stay like that. And why is it important for us to give the clinical picture of what we are seeing with patients to the world, or to share it with the world, is because of that very mild symptoms that the patient has. The patient only knows he's not feeling well. As I've described, the body aches and pains and the slight headache, the fatigue, this sort of scratchy throat, and then present at his doctor. Doctor doesn't, because the patient is not looking acutely ill, especially the older patients, the 20-year plus. They would easily miss this as just a normal viral infection or whatever the diagnosis would be. So that's the one thing, that we need to get the message out there. Please be on high alert. The second one is we need to tell the patients out there that if you have this type of all of a sudden tiredness, body aches and pains, not feeling well, with a bit of a scratchy throat, please go and see your doctor. Get tested. So if we can get that message out there for now, I think we would do us all a very big favor going forward. And we would hopefully then get people not to be at work, because with that type of picture, you will still go to work if you are, if you are working for yourself, or if you have a very high workload at the end of the year. And that's when you were going to, if you're not vaccinated or other people are not vaccinated working with you, that's how you're going to spread this fast-spreading virus.
Look, we've just seen so many variants of this COVID so far. Why is the virus mutating just so quickly, with each strain having different symptoms? Is it somehow trying to survive?
I think the virus is trying to survive. It is in the best interest of the virus not to kill off everyone, because once everyone is killed off, he will die as well. So they're not that stupid. So the virus, would like to mutate and escape the body's immune system so that the virus can live in peace with you, mutate and then infect someone else going forward. We know that in Africa, we have a lot of people with immune-compromised diseases, some of them well controlled, others not, and some of them not vaccinated, most of them not vaccinated. And that's where the danger is lying. So if you've got an immune-compromised disease, not well controlled or not controlled at all, unvaccinated, that's the ideal host for the virus to go and mutate.
And Doctor, many of us have had 1, 2, and now 3 vaccines. Tell me, just how effective are they?
For now, and remember, the whole picture might change. We just say for now what we are seeing. The patients that had been vaccinated, I'm just busy drawing up a comparison of what I have seen, but people vaccinated who got breakthrough infections, very mild diseases. For now, that's what we see now. And remember, the whole picture might change going forward. And I think it's important to take note that the majority, it's not that we had a lot of breakthrough infections with vaccinated people, but most of them had been vaccinated between July and August this year. And so it fits in with the picture that you need with Pfizer a booster between 3 or 4 or 5 months later, after you have completed your 2 shots. And again, I think it's also important to keep on emphasizing that the main objective of getting people vaccinated is at this stage, is to try to get them out of hospital, try to not let them get severe disease, and try to prevent death, unnecessary death. We know that if you have been vaccinated, that you will still get mild disease. And if this is what we are seeing in the surgeries, that it's still mild disease, then we are also happy for those people who have been vaccinated. So going forward, I'm afraid people with chronic diseases might not end up to be so lucky, but that only time will tell us.
And Doctor, we saw a lot of these countries just slamming shut their borders when this new variant came out. Tell me, was this adequate? Is it the right move in your opinion?
think it's a very difficult response. It's like a knee-jerk response. So I know the countries are saying that they need to protect their people in their own countries. The interesting part is because of this type of clinical picture that we are currently seeing, and again, I'm emphasizing it might change going forward. So please, if after 3 weeks or 4 weeks from now on we see severely ill patients, most of them are ill, just remember we have said that it might change. But for now, if you look at these patients, and I think that's why it was so easy for patients who tested positive after they came from South Africa to other countries, it's because they're not very sick, and they don't feel. They might not feel fine, but they're not sick, and everyone is waiting for a patient to get severely ill. You don't want patients to end up to be severely ill, and we need to stop this or to mitigate our risks as much as possible. So by closing your borders, you are maybe already seeing, other countries are maybe already seeing these type of patients without knowing and not thinking that to test them, and so spreading the virus. So yeah, I think there should have been other ways than just all of a sudden within 24 hours starting to close down borders. That's not going to help any country.
And finally, Doctor, you've given us then so much really important information, but I want to hear some good news. Tell me, when is this going to end? My favorite saying is, and I unfortunately do believe it as well, is that no one of us will ever sleep safe if Africa has not been vaccinated. And that's where your mutations will start. But we can only hope that the virus mutate himself to become much less harmful to the people out there, and become more like a cold and flu type of yearly occurrence. But only time will tell us, and the virus might surprise us and become extremely virulent. So what is the first prize? The first prize for now, if we can stay with the clinical picture that we are seeing currently, with vaccinated people with breakthrough infections that's not severely ill, majority of patients be treated at home with mild diseases, not really needing oxygen or any real pharmaceutical interventions, but conservatively being treated, that will be the first prize. So let's hope and pray. But the time within 2 to 3 weeks from now on, if we have this conversation, I will maybe still give you good news, or I will say to you, it changed, it totally changed.